What's up, Doc? What's up, Doc? What's up, Doc? What's up, Doc?
Hello viewers, I'm Dr. John McRae, a General Surgeon at Royal Medical Center, and welcome to WAZZ UP DOC. Today we're going to meet Loy. She's a patient who is coming to see me today with a common complaint of indigestion, or gas as Jamaicans call it. So we're going to go through talking to Loy, getting some information from her about the complaint that she has, doing an examination, and then seeing if we can come to a diagnosis and offer her some investigations to find out what the cause of this gas or indigestion might be, and then the appropriate treatment.
What's up, Doc?
Okay, Lloyd, tell me what's been happening with you.
Well, Doc, I've been having some pain in my stomach.
Okay. About how long would you say?
About 4 months.
About 4 months,
Yes.
right? Quite a while. Can you point with one finger and show me where you feel the pain most times?
Right here, sir.
And it bothers you all through the day?
Or after I eat, there's a discomfort.
So it gets worse after you eat?
Yes.
Does it make you vomit?
Yes, because when I vomit, I feel a little relief.
Okay.
So,
Okay. Does the pain move anywhere at all?
yes, it does.
Where does it move? Do you ever feel it going through to your back?
Yes, sir.
Okay. So after you eat, you feel unwell and you vomit and you feel a bit better. What's your appetite in time though?
Well, I have lost appetite for you.
Over the 4 months?
Yes, sir. And I have lost weight.
About how much weight do you think you have lost?
About 10 pounds.
Okay, that's quite a little weight. Before this, you ever had that kind of pain before?
No.
And before this all started, were you taking any medications, painkillers, even recently?
Well, recently I've tried aspirin,
Right.
but it doesn't give a long-lasting effect.
Right.
Yes.
Well, what we need to do now is to examine you. So we're going to come across to the examination couch. And then we discuss what we think the problems are and how we come to a solution. Okay, Loy, so I'm just going to give you an example of what it is that we do at endoscopy. So we have to get you to swallow a tube, which has a camera and a light on the end. Just to make it easy to go down, we're going to spray the back of your throat with this, which is a nice local anesthetic spray to make it numb. And the nice part about it is that you can actually watch on television as we go along. We are going to put this in your mouth, just between the teeth, just to protect your teeth, and the tube actually goes through there. And when it gets to the back of the throat, I'm going to ask you to swallow, and it will go down. This is the endoscope here. A small tube. Yeah, so it's very easy. And we can move around and look up, down, left, right in the stomach. And you can see everything on the screen. As we pass the endoscope in, and that's how it looks. We can turn. And what we are doing is looking at the lining of the stomach and the gullet as we go down. And we can see if there is anything wrong. There. You can even see there. And if we see anything that's wrong in there, like a little growth, we can take a little sample of tissue at the same time. We call that a biopsy. And that is totally painless to you. And all of that is done through this equipment here. It's a short procedure, probably takes about 10 or 15 minutes. Very comfortable. Give you a report immediately at the end of it. If we do any biopsies, it takes about 2 to 3 weeks to get the result back. And then we'll know what specific treatment you need after that.
So, Doc, are there any side effects to it?
There are. I'm going to give you that leaflet to read through them. Most things that patients complain about is a little sore throat afterwards. Nothing significant. It will be gone in about a day or so. When we do the biopsies, if you're watching on the screen, you'll see a little bit of bleeding.
Yes.
But that is very magnified. It's very minor bleeding that will stop on its own. But it's a pretty safe and straightforward procedure. And as I said, I'll give you the brochure to read.
Yes.
And then when you have booked the procedure downstairs, then on the day of the procedure, any questions you have to ask, we can go through those.
So I just go downstairs when I'm finished.
When you're finished, and the receptionist will make an appointment for you.
I'd like to make an appointment with Dr. McLean to do an endoscopy, please.
Endoscopy is a procedure for really looking inside the body. This could be inside one of the body cavities, or it could be inside the intestines, whether the upper intestine, stomach, small intestine, or whether the lower intestine or the colon. And how this is done, we actually have a slender tube which carries a camera and a light, and we literally have wheels that we can steer the direction of the end of the tube. And we can look around at the lining of the various cavities. In my case in particular, I look at the digestive system, both the upper digestive system, mainly the stomach, the first part of the small intestine, and the gullet, or esophagus as we call it, and also the colon, which is the large intestine. And by looking at the lining, it allows us to pick up a number and diagnose a number of disease processes. I break it up into the ones for the upper digestive tract and the lower digestive tract, or the colon. In the case of our patient that we saw, a lot of people complain of indigestion. And indigestion can be for a variety of reasons. It could be what we call acid reflux, which is one of the commonest causes. It could be peptic ulcer disease, or ulcers as we know it. And the greatest fear of all is stomach cancer. And upper endoscopy is very important because a lot of patients, in fact all the patients I've seen in practice who have stomach cancer, thought that they had gas and have been treating it with a variety of home remedies, sometimes antacids, sometimes medications prescribed by their doctor, without any success. And like any cancer, if you're going to treat stomach cancer, you need to find it when it's very early. And so upper endoscopy is a fairly straightforward procedure. It doesn't require any form of putting the patient to sleep or general anesthetic. It can be done quite simply by spraying the back of the throat with a local anesthetic, which makes it nice and numb. And it's a fairly short procedure. It can be completed in about 10 or 15 minutes. So you come in, have the procedure, and you're out in about half an hour, with setup time and doing the procedure and so on. Doesn't require a lot of preparation, just that the stomach has to be empty. So we normally ask our patients not to eat or drink anything for about 8 hours before the procedure. And you don't necessarily have to be accompanied by anybody. You can get up and go as soon as the procedure is done. And we can generate a report at the same time to give you an idea as to what is happening. At the other end, colonoscopy is a little bit different. And that requires a bit more rigorous preparation. We're going to be looking at the lining of the large intestine, or the colon, and therefore the colon has to be clean, totally clean. And the day before the procedure, you go on a special diet, which is pretty much drinking liquids for the whole day, and some fairly powerful laxatives to clear the bowel out. The colonoscopy is a little bit more uncomfortable though, and so we actually use the services of another doctor, an anesthetist, to give you some medications through the vein for pain and also to sedate the patient. Make you drowsy, but not fully asleep. It's not a general anesthetic, which seems to be the greatest fear that most patients have of colonoscopy. So we pass the instrument. The procedure is a lot lengthier. It probably takes about an hour on average to complete the procedure. And between the procedure and recovery from the sedative injections that we have given and the painkillers, the total duration of time is probably about 3 hours. But it allows us to look at the lining of the colon. We're really looking out for colon cancers. Ideally, we'd like to find them before they get to cancers, and there are some little growths in the large intestine called polyps, which if they're there and we find them and get rid of them, we can totally prevent colon cancer, because we already know that most, if not all, colon cancers grow from these adenomas. If you leave them alone, or the polyps are adenomas as they're called, within 5 to 10 years a number of them can become colon cancers. Most people really refer to a sort of discomfort in the stomach, usually after eating. A lot of the times with belching and feeling that the food just not settling down. It's not a term that we like to use because a number of other problems that affect the upper digestive system can give you similar symptoms that people call gas. And really, it's something that ought to be diagnosed correctly so that you get the appropriate treatment. And more importantly, that you're not missing something that could be potentially serious and even life-threatening. So some of the key points to indicate when you should really be seeing a doctor when you have what you call gas is if this is happening for the first time and you're over the age of 40. And the reason for that is that cancer is also more common as you get beyond the age of 40. And it's like all cancers, stomach cancer is a big problem. And the earlier that you can detect it is the more successful treatment will be. So some of the key points to look out for that might suggest to you that this type of gas should really be diagnosed correctly by a doctor would include significant pain, especially in the upper stomach area after eating. If your appetite is not as good as it used to be, that is a major red flag, as we would say, and you should definitely consult a doctor if that arises. If in association with a loss in appetite, you're also losing a significant amount of weight and you're not actually trying to lose weight, but you find, how do you know that you're losing weight? Because you don't really weigh yourself. Sometimes your clothes just, you notice that your clothes get a little bit bigger. The shirt or the blouse fits a little bigger. You have to pull the belt at the waist of the pants a notch tighter. All of this might indicate that you're losing weight. Or somebody who hasn't seen you in a while might just look at you and say, but I think you're losing weight. That should be taken quite seriously. Vomiting after meals, especially if you find that you're getting some relief after you vomit, might be an indication that there's a blockage to the upper part of the digestive system. And apart from cancers, ulcers can also do that as well. And both are pretty serious problems that need to be properly diagnosed. Weakness is another common symptom that we see, and that's because the stomach cancers cause you to lose blood in small quantities. You're not going to notice it, but your blood gradually gets weaker as you get more anemic, and you might find that you just don't have the same energy as you used to. You get fatigued doing your usual task. All of those might be signs of anemia, and if you have that in addition to gas, then you definitely need to be seeing your doctor. And most importantly, I know everybody tries a little home remedy. You have all the antacids like Dica and Fedogel that you can get over the counter, or sometimes the doctors prescribe a little stronger medication like Zantac or Lanzap. If those are not working, then the gas has to be investigated to find out whether or not you have a more serious problem such as stomach cancer. And by far the best test is to have a direct look inside the gullet and stomach and the first part of the intestine by doing endoscopy. And that is the most important test for determining whether the gas that you're experiencing is something serious, such as an ulcer which needs to be treated before it develops complications, or a cancer which definitely needs to be treated, Or if it could be something simple like acid reflux that really only needs medication to give you some measure of relief.